This movie shows the two-stage dental implant placement method. In this situation, the flap is raised to expose the bone. The bone is drilled to prepare it for the implant fixture, which is placed and then covered with a cover screw. This cover screw is very thin and just covers the opening of the dental implant. The flap is then repositioned over the implant and sutured into place. After the appropriate waiting time, the implant is exposed, the cover screw removed and replaced with the healing cap. The tissues are then repositioned around the healing cap and allowed to heal after the appropriate healing time. The healing cap is removed and the crown base. And the implant crown are placed on the dental implant fixture.